The piriformis muscle, why it is important. So what is the clinical significance of the piriformis muscle? The sciatic nerve may become compressed or irritated by the piriformis muscle, which can give piriformis syndrome. Piriformis syndrome is a hidden cause of sciatica. Always consider the possibility of piriformis syndrome when treating patients with sciatica, sacroiliac joint pain, or trochanteric bursitis that's not improving, or in patients with sciatica, especially after failed spine surgery. The piriformis muscle will irritate the sciatic nerve, and the pain will go down into the back of the buttock, into the posterior thigh, and into the back of the leg. In piriformis syndrome, the patient may have symptoms of sciatica that may be similar to disc herniation symptoms. How do you diagnose piriformis syndrome? High index of suspicion, patient history and exam. They found that there are 3 common symptoms that the patient experiences in piriformis syndrome, which include buttock pain, aggravation of pain with sitting, point tenderness over the greater sciatic notch. The diagnosis of piriformis syndrome is made clinically with the pain being in the posterior gluteal region. Patient will have localized buttock pain increased by sitting or driving. Patient may have tenderness in the sciatic notch, and the pain is increased by bicycling or running in young individuals. Patient will have radicular symptoms with pain and paresthesia. Pain may be present when palpating directly deep into the area of the greater sciatic notch. The cause of piriformis syndrome is not fully understood. There might be anatomical anomalies that lead to compression of the sciatic nerve. The sciatic nerve is compressed by the piriformis muscle, by fibrous bands, or by vascular anomalies. MRI may show enlarged piriformis, anomalies of the vessels, or compression of the sciatic nerve. Tightness or spasm of the piriformis muscle may cause irritation of the sciatic nerve itself. The pressure being placed on the nerve may cause swelling and inflammation. The symptoms of piriformis syndrome occasionally develop from blunt trauma to the buttock. In piriformis syndrome, the sciatic nerve can become irritated, where it runs under the piriformis muscle in the buttock region. And when the piriformis muscle irritates the sciatic nerve, it can cause sciatica. The patient may complain of pins and needles down the leg, and confusion may occur as the patient may be misdiagnosed as having a lumbar disc herniation. Piriformis syndrome is not a true lumbar-radiculopathy. A true sciatica is caused from irritation of the nerve root itself by a disc herniation. Lumbar-radiculopathy and true sciatica is a spine problem. Piriformis syndrome is a muscle and sciatic nerve problem. The diagnosis of piriformis syndrome should be done by exclusion of any other possible spine problem which could compress the spinal nerve root and cause true sciatica. A high index of suspicion is needed in patients with buttock or leg pain in the absence of lumbar disc herniation on an MRI. We must look at the spine first and exclude spine problems, because spine problems are the most common cause of sciatica, and piriformis syndrome is not that common. If the patient complains of sciatica and the MRI of the spine does not show there is a disc problem, then the patient probably has a piriformis syndrome. It is really hard to differentiate between piriformis syndrome and lumbar disc herniation because both conditions can cause sciatica And because there's a lot of positive findings in the MRI, which does not mean that disc herniation or bulge that's present in the MRI is causing the patient's symptoms. There's a lot of patients that have disc herniation and disc bulge on MRI that are asymptomatic, that does not cause them any symptoms. Therefore, you must correlate the MRI findings with the clinical examination of the patient. How do you know the primary source of pain? In fact, the patient may have both conditions of herniated disc and piriformis syndrome. There are clinical examinations that are commonly used to diagnose piriformis syndrome, and these are called provocative tests. The Lesueur maneuver stretches the sciatic nerve. The Feder test stretches the piriformis. The Lesueur maneuver reproduces the pain by flexing the hip to 90 degrees while keeping the knee extended. I prefer to do that test with the patient on the side so I can localize the site of the pain, which is directly over the piriformis muscle. How about Feder test? The test is done by stretching the piriformis muscle to see if it is causing irritation and pressure on the sciatic nerve and reproduce the patient's symptoms. The test is done by flexing, adducting, and internally rotating the hip. If you are not sure about the diagnosis, then diagnostic injection of the piriformis muscle may be helpful. Treatment of piriformis syndrome. Water therapy, physiotherapy, non-steroidal anti-inflammatory medication, injections, diagnostic injection is helpful. Surgery is the last resort. Surgery is done at the last resort and after we exclude all other causes of spine conditions and after the patient has an immediate positive response from injection around the piriformis muscle. Surgery will entail release of the piriformis muscle and decompression of the sciatic nerve. Thank you very much. I hope that was helpful.